Understanding rheumatoid arthritis: causes, diagnosis, and treatment options. What causes rheumatoid arthritis? 1. Rheumatoid arthritis is a disease where the body's immune system cells mistakenly attack the healthy tissues, particularly the joints. 2. Although the exact reason behind the occurrence of rheumatoid arthritis is still unknown, recent studies are providing us with better insights into how the immune system triggers the inflammation that causes RA. 3. The inflammation caused by RA primarily affects the synovium, which is the tissue that surrounds and lines the joints. 3. The immune cells release certain chemicals that lead to inflammation, which can harm the cartilage and bone tissues. 4. Besides the immune system's dysfunction, several other factors, including genetic traits that affect the immune system, may also contribute to the development of rheumatoid arthritis. WHO gets rheumatoid arthritis? 1. Rheumatoid arthritis is the most prevalent type of autoimmune arthritis. 2. The disease affects approximately 1% of the population and is more common in women. 2. In fact, about 75% of all rheumatoid arthritis cases occur in females. 3. Women have a higher risk of developing RA, with 1 to 3% of them estimated to develop the condition at some point. 4. Rheumatoid arthritis usually starts between the ages of 40 to 60 years old, but it can also begin at any age. How is rheumatoid arthritis diagnosed? 1. Identifying rheumatoid arthritis can be challenging since the initial symptoms, such as joint stiffness or ache in the morning, may be mild. 1. Moreover, other diseases may mimic the early symptoms of rheumatoid arthritis. 2. The diagnosis of rheumatoid arthritis relies on the physical examination of the affected joints, including warmth, swelling, and pain. 2. Blood tests may also assist in confirming the diagnosis of rheumatoid arthritis. 3. Certain signs are indicative of rheumatoid arthritis, such as low hemoglobin, rheumatoid factor, an antibody in the blood found in many rheumatoid arthritis patients, anti-CCP, another antibody, an elevated erythrocyte sedimentation rate, which signifies the amount of inflammation in the joints. 4. X-rays are useful in detecting rheumatoid arthritis, but they may not reveal any abnormalities in the early stages of the disease. 4. However, X-rays taken during the initial phase may provide valuable information about the progression of the disease over time. 5. MRI and ultrasound scans are now routinely performed to assess the severity of rheumatoid arthritis. 6. There is no single definitive test can confirm the diagnosis of rheumatoid arthritis, particularly in patients who have experienced symptoms for less than 6 months. 6. The diagnosis is based on clinical symptoms, physical examination findings, laboratory test results, and imaging studies. How is rheumatoid arthritis treated? 1. Treatments for rheumatoid arthritis have significantly improved over the past 3 decades, allowing most patients to achieve good or excellent relief of symptoms. 2. Although there is no cure for rheumatoid arthritis, proper medical therapy can reduce symptoms and prevent lasting joint damage. 3. Effective management of rheumatoid arthritis involves early diagnosis, aggressive treatment, and a combination of medications, including DMARDs, NSAIDs, and low-dose corticosteroids, with or without newer drugs like biologicals, rituximab or infliximab, and JA-NIBs, tofacitinib or baricitinib. 4. DMARDs are disease-modifying antirheumatic drugs that relieve symptoms and slow the disease's progression. 5. Common DMARDs include methotrexate, leflunomide, hydroxychloroquine, and sulfasalazine. 6. For patients with more serious rheumatoid arthritis, biologic response modifiers or biologic agents may be prescribed to target the immune system and reduce inflammation and joint damage. 7. In addition to medication, patient education and the involvement of a team of healthcare providers, including rheumatologists, primary care physicians, and physical and occupational therapists, are important for proper care. 8. Regular checkups and monitoring of disease progression and medication side effects through blood tests, X-rays or ultrasounds, and frequent visits with a rheumatologist are necessary to effectively manage rheumatoid arthritis. What are the wider health consequences of having rheumatoid arthritis? 1. Increased risk of cardiovascular disease. People with rheumatoid arthritis are at a higher risk of developing heart disease than those without RA. 1. Inflammation is thought to be a key factor in this increased risk. 2. Respiratory problems. Rheumatoid arthritis can cause inflammation in the lungs, leading to shortness of breath, chest pain, and a dry cough. 3. Eye problems. Rheumatoid arthritis can cause eye inflammation, leading to dry eyes, eye pain, and blurred vision. 4. Depression and anxiety. Chronic pain and disability from rheumatoid arthritis can lead to depression and anxiety. 4. Some studies have shown that people with rheumatoid arthritis are at a higher risk of developing these conditions. 5. Reduced mobility and disability. Rheumatoid arthritis can cause joint damage and deformity, leading to reduced mobility and disability. 5. This can make it difficult to perform daily activities and reduce the overall quality of life. 6. Increased risk of infections. Rheumatoid arthritis and its treatments can weaken the immune system, making people with RA more susceptible to infections. 7. Increased risk of osteoporosis. Rheumatoid arthritis can lead to bone loss and an increased risk of osteoporosis, increasing the risk of fractures. Points to remember. 1. Rheumatoid arthritis is a chronic autoimmune disease that can cause significant joint pain, stiffness, and swelling. 1. Early diagnosis and treatment are essential to prevent joint damage and improve long-term outcomes. 2. There is no cure for rheumatoid arthritis, but with the right treatment, many patients can achieve remission and experience little to no disease activity. 3. Nonsteroidal anti-inflammatory drugs, NSAIDs, and corticosteroids can help reduce inflammation and pain in the short term, but they are insufficient to manage the disease independently. 4. Disease-modifying anti-rheumatic drugs, DMARDs, are the cornerstone of rheumatoid arthritis treatment. 4. They not only relieve symptoms but also slow the progression of the disease. 4. Newer therapies have proven to be efficient in treating rheumatoid arthritis. 4. DMARDs have significantly enhanced the results for patients, leading to a reduction in joint pain and swelling, as well as limiting joint damage in the majority of patients with rheumatoid arthritis. 5. Regular follow-up with a rheumatologist is essential to ensure that treatment is working effectively and to make any necessary adjustments. 5. Patients should not stop taking their medication without consulting their doctor. 6. In addition to medication, lifestyle changes such as exercise, a healthy diet, and stress management can help improve overall health and quality of life for patients with rheumatoid arthritis. 7. Patient education and support are also critical components of managing rheumatoid arthritis. 7. Patients should learn as much as possible about their disease, communicate openly with their healthcare team, and seek resources and support groups as needed.